Understanding Mpox, a global health concern. Mpox, also known as monkeypox, is a disease that has been causing increasing concern around the world. Mpox is a serious disease that affects both humans and animals. It can lead to severe health complications if not treated properly. It is caused by a virus that belongs to the same family as the smallpox virus. This virus can be seen under a microscope, revealing its complex structure. The virus can spread from animals to people, particularly through direct contact with the blood, bodily fluids, or skin lesions of infected animals. This zoonotic transmission is a key factor in the spread of Mpox. It can also spread from person to person through respiratory droplets, close contact, and even contaminated materials. This makes it highly contagious in crowded or close-knit communities. Mpox is a global health concern because it has the potential to cause outbreaks in many countries, affecting people across different continents. This is because it can cause outbreaks in many countries, leading to widespread panic and the need for stringent health precautions. Mpox can make people very sick, with symptoms ranging from fever and rash to more severe complications like pneumonia and encephalitis. It can even be deadly, especially for those with weakened immune systems or underlying health conditions. That's why it's important to learn about Mpox, understand its transmission, and recognize its symptoms early. We need to know how to protect ourselves and others by practicing good hygiene, wearing masks, and using hand sanitizers. We must work together to stop Mpox. This requires a coordinated effort from communities, healthcare systems, and international organizations. This includes governments, healthcare workers, and everyday people. Everyone has a role to play in preventing the spread of Mpox. By understanding Mpox, we can stay healthy and safe. Knowledge and proactive measures are our best defenses against this global health threat.
Tracing the origins, from animal to human. The journey of Mpox from animals to humans is a fascinating and complex story that spans decades and continents. Mpox has a long history, one that is deeply intertwined with the natural world and human activity. Scientists believe it first appeared in animals living in the dense forests and savannas of Africa. This was likely in Central or West Africa, regions known for their rich biodiversity and close human-wildlife interactions. The virus jumped from animals to humans, a process that can occur when humans encroach on wildlife habitats or come into direct contact with infected animals. This is called zoonotic transmission, a phenomenon where diseases are transmitted from animals to humans, often with significant health implications. The exact animal source of Mpox is unknown, despite extensive research and field studies. However, rodents are suspected to be carriers. These include rope squirrels and Gambian pouched rats, which are commonly found in the regions where Mpox outbreaks have been reported. Contact with these animals can spread the virus, especially if there are bites, scratches, or direct handling of the animals. The first human case of Mpox was in 1970, marking the beginning of our understanding of this disease in humans. It was in the Democratic Republic of Congo, a country that has since been central to Mpox research and monitoring. Since then, outbreaks have occurred in several countries, highlighting the need for ongoing vigilance and research. Most outbreaks are in Africa, but the global nature of travel and trade means that Mpox can potentially spread to other regions, making it a concern for public health worldwide.
Unraveling the transmission: how Mpox spreads. Mpox spreads in a few ways. The virus can spread through close contact. This includes touching an infected person's rash. It can also spread through contact with their bodily fluids. Mpox can also spread through respiratory droplets. This happens when an infected person coughs or sneezes. The droplets can infect someone nearby. This is more likely with prolonged face-to-face contact. Lastly, Mpox can spread through contaminated materials. This includes bedding, clothing, or towels. Touching these items can transmit the virus. It's important to disinfect surfaces and wash materials properly. a global impact Mpox cases around the world. Mpox, also known as monkeypox, has emerged as a significant global health issue, affecting numerous countries across various continents. Mpox is a global health concern. The virus does not discriminate, impacting people from all walks of life, regardless of their location or background. It has affected people in many countries. From small island nations to large, densely populated countries, the reach of Mpox is extensive and concerning. Outbreaks have been reported on different continents. Urban areas, with their high population density, are particularly vulnerable to rapid virus transmission. This shows that the virus can spread easily. International travel and trade have facilitated the spread of Mpox, making it a truly global issue. While Mpox is more common in Africa, recent outbreaks have changed things. Historically, Mpox was primarily confined to certain regions in Africa, but recent developments have seen it spread far beyond these areas. Cases have been reported in Europe, North America, and Asia. Major cities in these continents have reported significant numbers of cases, highlighting the virus's ability to cross borders. This highlights the need for global cooperation to control the spread. International summits and meetings have become crucial platforms for discussing strategies to combat the virus. The World Health Organization, or WHO, is monitoring the situation closely. The WHO has been at the forefront, coordinating efforts and providing critical updates on the situation. They are working with countries to provide support and guidance. By collaborating with local health authorities, the WHO aims to implement effective measures to control the outbreak. International collaboration is key to containing the outbreak. The combined efforts of countries around the world are essential in the fight against Mpox, ensuring that resources and knowledge are shared to mitigate the impact of this virus. Section 5. Evidence of impact. Numbers. Tell the story. The impact of Mpox is evident in the numbers. Thousands of cases have been reported worldwide. The number of cases continues to rise, raising concerns. While the death rate from Mpox is relatively low, it is not to be taken lightly. People with weakened immune systems are at higher risk of severe illness. The outbreak has placed a strain on healthcare systems. This is especially true in countries with limited resources. It highlights the importance of investing in public health infrastructure.
Section 6. Combating Mpox. Current treatments and vaccines. There are treatments available for Mpox. Antiviral medications can help manage the symptoms. These medications can shorten the duration of the illness. Vaccination is a key tool in preventing Mpox. Smallpox vaccines offer protection against Mpox. These vaccines are effective in preventing severe illness. However, access to vaccines is limited in some areas. Efforts are underway to increase vaccine production and distribution. This is crucial to protect vulnerable populations.
Section 7. Protecting yourself and others. Practical steps. There are steps you can take to protect yourself from Mpox. Avoid close contact with people who have Mpox. Practice good hygiene, such as washing your hands frequently. Avoid contact with animals that could carry the virus. This includes rodents and primates. If you must be around these animals, wear protective gear. If you experience symptoms of Mpox, seek medical attention immediately. Early diagnosis and treatment can improve outcomes. Follow your doctor's instructions carefully.
Section 8. A collective effort. The importance of global cooperation. Mpox is a global health threat that requires a global response. International cooperation is essential to control the outbreak. Countries need to work together to share information. Sharing data on cases and outbreaks is crucial. This helps track the spread of the virus. It also helps identify areas where interventions are needed most. Collaboration on vaccine development and distribution is vital. Ensuring equitable access to vaccines is paramount. This helps protect vulnerable populations worldwide.
Section 9. The role of public health surveillance and response. Public health plays a critical role in controlling Mpox. Surveillance systems are essential for early detection of outbreaks. This involves monitoring for cases and tracking the spread. Contact tracing is an important public health measure. It helps identify and isolate individuals who may have been exposed to the virus. This helps break the chain of transmission. Public health education is crucial for raising awareness. It helps people understand the risks of Mpox and how to protect themselves. This includes promoting vaccination and preventive measures.
Section 10. Mpox in the future. Research and preparedness. Ongoing research is essential for staying ahead of Mpox. Scientists are working to develop new treatments and vaccines. This includes exploring more effective antiviral medications. Research is also focused on understanding the virus better. This includes studying its transmission patterns and how it evolves. This knowledge can inform control strategies. Preparedness is key to responding effectively to future outbreaks. This includes having stockpiles of vaccines and medications. It also involves strengthening healthcare systems to handle surges in cases.
Section 11, Conclusion: Staying informed and vigilant. Mpox is a serious public health threat, but by working together, we can control its spread. Staying informed about the virus is crucial. Get information from reliable sources such as the WHO and your local health authorities. Be aware of the symptoms of Mpox and seek medical attention if you experience any. Practice good hygiene, avoid contact with infected individuals, and get vaccinated if eligible. By taking these steps, we can protect ourselves, our families, and our communities. Let's work together to stay healthy and safe.